Hi guys, thanks for your interest in Pillsbury House. This is a presentation for those of you who could not make it to the actual orientation. So in this video I'm going to briefly talk about what Pillsbury House is and what you can do to get involved. So first and foremost, what exactly is the Pillsbury House? So the Pillsbury House is actually not just a medical clinic, but it's also a sort of a community building located in South Minneapolis. And in this building, we have the medical clinic, or an integrated health clinic that's located on the third floor of the building. But the entire Pillsbury House is used for other services in the community, such as an early education program, and there's also after school programs and also some theater. So you will see some people there who are there for non medical related reasons. So Pillsbury House is a free clinic. So it serves the community, the Powderhorn community, free of charge. And particularly, Pillsbury House is actually a part of the Northwestern Health Science University. This is an alternative medicine school located in Bloomington, Minnesota. And so at Pillsbury, at least for the medical clinic part, there are certain services provided, and they are listed here. So we have chiropractic care, acupuncture, massage therapy, counseling, as well as health coaching. Now, the students who are involved in these roles are actually students directly from Northwestern Health Sciences University, and they are required to do a rotation at Pillsbury House. As for medical services, there's not exactly a formal sort of medical rotation because that's kind of where we come in. So University of Minnesota medical students actually volunteer to provide this service. So who exactly is the Pillsbury House Clinic? I kind of talked a little bit about this. So they're students from Northwestern Health Sciences University in the following modalities. And again, they are there for their actual rotation, so they're required to be there, whereas for medical students, we're purely sort of volunteering. And the clinic manager is Laconia Cooner. So she will be, you'll see her around. She typically is at the clinic. Well, she's always at the clinic, and she takes care of checking patients in and checking them out. And she essentially manages the entire clinic and makes it run. So if you have any questions at all, feel free to contact her, or even just come up to her in person if you need any help with anything, and she'd be glad to help you out. So when and where is the Pillsbury House? So the Pillsbury House is located at this address here. It's approximately about a 10 to 15-minute drive from our campus. And this is an image of the actual Pillsbury House. And again, the health clinic is actually located on third floor, so you can either take the stairs there or take the elevator there. And also another thing that I need to mention is that when you do arrive for your shift, you want to check in at the information desk there. And what I mean by that is there will be a sign-up sheet, and you just check in. You put your name, and you just check in what you're there for. You're here for volunteering at clinic, and when you're there, you'll see what I mean. But as far as parking goes, there's free street parking. And additionally, there's a small parking lot right behind this building, so parking shouldn't be too much of an issue. And clinic hours is open only on Wednesdays and Saturdays, so Wednesdays 5:30 p.m. to 9:30 p.m. and Saturdays 8:30 a.m. to 12:30 p.m. So now we can just dive into how exactly you can get involved in Pillsbury. So the commitment is pretty flexible. We require about once a month. And for each shift, it's about a 4-hour shift. And so we would have ideally 2 to 3 medical students and one physician supervisor per shift. And these physicians, I'll mention a little bit later, but they are part of the integrated health family practice medicine part of a university medical center. And so they take time out of their busy schedules to come and volunteer at Pillsbury and also work with the medical students there. So it's a very nice, rewarding time to just be able to spend time with the physician and learning special skills and gathering other information. So this is kind of the breakdown of how a typical day of volunteering at Pillsbury looks like. So what you want to do is arrive approximately 30 minutes prior to the opening time. This is around 5 p.m. on Wednesday and 8 a.m. on Saturday. And the reason why we asked you to come just a little bit earlier is because the Pillsbury Integrated Health Clinic on the third floor does not necessarily have actual rooms for each modality. Instead, it's pretty much just an open space area, and so therefore you have to set up your own little booth or little you have to kind of divide up the space into your own area, and I'll show you what that is in a couple slides. So essentially you just want to set up your medical area, and then after that you'll get chances to interact with patients. So typically for a shift, there's a maximum of, or there can be a maximum of 2 new patient intakes, and each intake lasts for about 1 hour. So on those days when there's new patients, you might be a little busier, since the whole intake process is pretty extensive. And in that process, what you do is you participate in, or you can lead a group interview with the patient. So how contacting the patient works in a new intake is it's a little bit different from what you're traditionally used to seeing in visiting your primary care clinic. Instead of just the doctor and patient together, instead we have a whole group interview with students from all the other modalities, including counseling, massage, chiropractic care, and acupuncture, including in addition to medical students. And so sort of a group interview where the patient sits with all of us, and we have sort of an open discussion of what the patient is coming in for, what the patient would like, what kind of treatments the patient's seeking. So sometimes the patient will come in and know that they're interested in massage or they're interested in counseling, and so we take that into consideration. And during this period, we have some paperwork in terms of just obtaining the HBI and documenting what exactly the patient is here for, and past medical history, social history, and all of that stuff. So this is a really great opportunity to practice your ECM skills. Additionally, so actually after the initial encounter with the new patient, we have the patient go actually to the medical area, and this is where you guys can do vitals on the patients and take their temperature, blood pressure, and pulses, and you can do a targeted physical exam if you find that it may be necessary or may be advantageous. So, for instance, if a patient's coming in with some sort of respiratory problems, you could go ahead, listen to your lungs. And again, this is a great time to practice those physical exam skills that you guys learn in ECM. And it's a great opportunity because you're able to practice these skills in a very low stress environment. And additionally, if there is a physician supervisor on the shift with you, you may also learn a lot. Number 7, so this is one of the most important things that we stress is here, do a wellness check on the patient. So this is kind of goes into what integrated healthcare really is. It's not just about focusing on the physical symptoms that the patient's coming in for, but it's really addressing the patient holistically. So we emphasize doing wellness checks on patients because a lot of times the patients that come into Pillsbury, they're coming in for chronic problems such as chronic pain, maybe soreness, muscle aches, and that kind of stuff. And a lot of times it's not so much that there's actually physically something wrong. It's oftentimes symptoms of depression and sort of a maybe something's not going well socially in life, and they're really stressed and they're lonely. And loneliness is actually one of the huge things in these patients. They just want someone to talk to and have some interactions. So doing wellness check is really important on these patients, and some questions you can ask is, how's home? How do you feel safe? How's diet? And really to gauge what the patient's home and lifestyle is really like, and then you can also, maybe counsel them about certain behaviors such as like drinking alcohol, letting them know that maybe it's not in the best interest in terms of their health. Going along with this, so we do have at the medical booth area, again I'll show you in one slide ahead, that we have a cart filled with relevant health information resources such as pamphlets, like contact information cards, all of that kind of stuff dealing with diabetes, obesity, information sheets, and all of that stuff is all provided. So you can distribute these to the patient as you see fit. So if a patient comes in with, maybe high blood pressure, you can give them a sort of informational sheet on high blood pressure and let them know what that means and how they can go about fixing that. Essentially, patient education. So Pillsbury, at least for medical students, we really do emphasize doing that wellness check and also listening to the patient and educating them on any questions they have or their conditions that they have. So after all of this, or when your shift is over, you clean up, which is doesn't take too long. You just put the carts back, the chairs, and everything back to where they were. And other opportunities. So sometimes when there aren't any new patients at all, that sometimes happens. So either there won't be anybody who come in, or maybe there will be patients who are coming up for a follow-up, and of course those are a little shorter encounters because they're not going to go through that extensive intake first new patient intake. So when there is downtime, you do have the opportunity to if you want, you can bring notes to study, whatever. If you're waiting for another patient to come in, that's fine. You can use that downtime however you want. But I would definitely encourage you to try to shadow some other modalities if you're interested, at least. I mean, it's definitely an opportunity. And what this means is that a lot of times the students in other modalities like acupuncture, chiropractic care, they're sometimes really friendly and free and available. So you can head on over there and kind of watch them and learn, what exactly acupuncture is about. And sometimes, if you're lucky, you may even get some of that. So, for instance, it may be possible that you could get a massage from a massage student, and ultimately, it's really a great learning experience. And one of the things about volunteering at Pillsbury is that we not only want to make this experience helpful for the patient, but we also want to make sure that the medical student gains a very valuable experience in terms of learning what exactly integrated healthcare is and really seeing it in action. Because a lot of times, perhaps some people do hear about what integrated healthcare is, but there's still a lot of confusion and about how it's implemented. And a lot of times for something like integrated healthcare, it really there's a big difference from actually hearing about it, reading about it, and actually experiencing it. So we do really encourage you, if you have the chance, to shadow other modalities and really see what it's like to be a patient in their sort of area. So, and also they have supervisors there for each modality, so they're typically really friendly. You can approach them and ask like, hey, I'm a medical student, I would like to learn about this, and typically they'll be nice about that. So this is what I mentioned earlier about the medical area setup. So this is a picture of what your setup should ideally look like. So we have medical carts that we have to set up here. We also have these dividers that we want to kind of bring in, so we can kind of have a nice little private area for the patient, and a chair, and this little bench thing where the patient can sit on. So again, these medical cards have information packets, pamphlets on obesity, hypertension, diabetes, mental health resources, suicide hotline numbers, and a bunch of other community resources. So this card also has blood pressure cuffs, thermometers, and also miscellaneous items. However, we do require you to bring your medical student name tag, so people know who you are. And it's not necessary to bring your white coat. So actually, there's actually no official dress code, but actually, I was sorry, I was supposed to change this, but there's actually no official dress code. You can come in with casual wear, jeans, cardigans, all of that is fine. Business casual is not required, so you can ignore this part. And also bring your stethoscope, so that would be really important and give you a lot of opportunity to do some physical exam. And you can bring a reflex hammer if you want to, but I think we have, yes, we do have some of those sitting around. And so this next part, I'm not going to go through it. You guys can pause the slide and read it yourself, but we just gave a sort of a mini brief summary of what exactly is integrated healthcare. So you can read this if you'd like. So this slide is just the basic definition of what exactly integrated healthcare is, and this is a quote from the World Health Organization. And we kind of just go through different modalities and kind of explain what they are. So chiropractic care, there's that. Acupuncture, just some information on that. Massage, and then health coaching and counseling. We kind of lump these together, but the health coaching is very different from counseling. They kind of address different sort of aspects. However, it's very important in integrated healthcare. So when do you exactly start volunteering? An Excel spreadsheet will be sent out for October shifts through email, and so every month, in the beginning of the month or the month prior, the end of the month prior to the actual shift, you'll receive an email for a link that goes to the sign up sheet, and you can sign up for your shift. So when you do sign up for a shift, please put your name and the year you are in the sign up slot, because there will also be MS2s, and it's nice to kind of pair up MS1s and MS2s so you can have a more fulfilling experience, and you can learn a lot about from MS2s and kind of chat with them. So if you do remove your name and can no longer volunteer on the shift within 48 hours, please email Pillsbury Clinic Medicine at gmail.com, or you can directly contact me at my email. And the reason why we require you to do this is sometimes when we have physician supervisors there and no student shows up, that's kind of that doesn't look very good on our part. So if you can let us know in advance that you're not going to be there, and it just so happens that no student is there but a physician is there, then we can let the physician know, and he or she can spend their time for other obligations. And so any questions, please feel free to contact any of us. This is the board for 2016, and again, clinic manager is Laconia. Again, you'll see her all the time, and she's very helpful. If you have any questions at all, please ask her, or ask any supervisor that's there, including the physician supervisor. So just the last couple things that I want to show you guys here. So I'm not going to jump there quite yet. So we kind of mentioned about doing a wellness check, and this is just I think I will be sending you guys a copy of this. Just some tips of how to address wellness checks for patients. So this is just this kind of goes through that. So you can read it, and that'll hopefully give you some ideas of how to approach patients and checking in on them. And we have a sort of SOP-like document, a sort of a manual for volunteering at Pillsbury. So this is about 10 pages. You don't have to read. This is just very detailed, but if you're curious, I think most of what I mentioned in this video is pretty much sufficient. But this here does go very in depth of what your roles are. So, patient appointment, subsequent visits, and a bunch of other stuff. Just for your information. So preventative healthcare screening, it's also important when you get a chance to talk to patients, let them know about health screening, let them know about vaccines and all of that kind of stuff. So, yep, so that's that file. And lastly, here's the sign-up sheet. So again, you'll get an email that'll have a link to the sign-up sheet. So how you sort of navigate this is you find the month. So for instance, in October, you can click on that. And here is the medical student sign up. So again, there's 3 slots here for students and 1 slot for the medical faculty. And you can also see the students who volunteer in other modalities. And here you can see medical faculty. So Dr. Lawson will be there on October 19th, and Dr. Dolan will be there on October 26th. And we are also having 2 more physician facilitators who are very excited to volunteer at Pillsbury, and hopefully they will join in the upcoming months. But again, it's really a wonderful opportunity to volunteer at Pillsbury, and we really want this to be a great experience, not only for patients, but again for you guys. So with that, I think that's all. If you guys have any questions, please feel free to contact us. You can either email me or the Pillsbury Clinic email. And I think that's it. So thank you for your time, and I hope your first shift at Pillsbury is wonderful.